Hello, good morning. I'm 𝗏𝗧𝗍. Welcome to Heart to Heart with the Doctor, presented by 𝗪𝗰 Medical Center, Sunway City. Well, pardon me, maybe I should say Heart to Heart with the Doctors. Because today we're not going to just have one, not two, but we're going to have three doctors, all right? Okay, before I starting the show, before I restarting the session, can you all please help us out by liking this FB Live? And also, can you please do us a favor by sharing this FB Live out, all right? Okay, in conjunction with World Cancer Day on February 4th and International Women's Day on March 8th, today's topic is going to be around women's well-being physically and emotionally, all right? I hope that is enough incentive and motivation for you to share out this FB Live. It is not, let me give you some reason why you should share out this FB Live, because it's really important for your daughter, for your mothers, for your grandmother, or even for your girlfriend. And if you are a lady, even it's very important for you. Today, we're going to cover some topics that include women health screening. All right. Often enough, every time you would hear about tumor marker test, right? But do you know that tumor marker test is not the most effective way of detecting tumors? Surprise, right? We will tell you why later. On top of that, we also will cover some what we call so-called taboo or concern in the society. For example, can a cancer patient have sex during treatment? But to me, honestly, I don't think this is a tough question, because sex is part of life. It's part of our well-being. We should not be preventing of talking about it. We should be open about it. Of course, if you think in an obscene way, there's a different issue altogether. Okay, so I hope that is enough motivation for you to share out this FB Live. If not yet, let me give you some incentive, right? If you share this FB Live, you will win a Grab voucher. We have prepared 5 of them, and we will announce the winner between 11:15 to 11:30 in the show itself. So please share out this FB Live. And of course, if you can, also please keep liking our FB Live so more people will get the right information from the right platform from our doctors, right? Definitely it's not someone from your WhatsApp group. Please don't listen to them. Please don't listen to your neighbors. Please listen to the professional. Please listen to our doctors. All right, without further ado, please allow me to introduce our doctors. Okay, the first on my right is Dr. Christina Lai.
Hello, good morning.
And then in the middle is Dr. Jennifer Leung.
Hi, thank you so much for joining us here today.
And then last but not least, we have Dr. Thong.
Thank you, 𝗪𝗧𝗍. Hi, everyone.
All right, Dr. Christina and Dr. Jennifer are both oncologists. They have more than 15 years of expertise in the field, whereas Dr. Thong is a medical officer in the 𝗪𝗪𝗏 Wellness Center. Okay, I think today is gonna have a lot of questions. So I will get straight to the question, because I'm sure a lot of you will have a lot of questions to ask as well. Yes, I will encourage you to ask as many questions as you could. And today is very, what do I call in Cantonese, 好難得. Because it's first time ever I have 3 doctors, Usually I only have 1 doctor. Yeah. So kind of good also, you all can share the load, right?
Yes.
That's true.
But I'm sure they have 15 years of experience in the field, so they can answer any question that you have. So I would like to ask Dr. Thong, right, since you are from 𝗪𝗪𝗏 Wellness Center. It is my understanding that 𝗪𝗪𝗏 Wellness Center provides screening programs and personalized consultation. When in the layman's term, I would call it as medical checkup annually. So when we talk about annual checkup annually, right, is the first thing came into my mind is urine test, blood test. So what else is 𝗪𝗪𝗏 Wellness Center offer?
Yeah. So many people have this mindset like, oh, I've done a complete health checkup. Then when you ask further, it's just blood and urine tests. Actually, there are many more other things to do. For example, mammogram, ultrasound breast, ultrasound abdomen, pelvis, chest X-ray, pap smear, a lot of things. And these are actually very important to have a more thorough check about your health. So in 𝗪𝗪𝗏 Medical Center, we do provide all these screening tests as well.
So, is all this tests included in your women health screening package?
Yeah, we have a few packages. Yeah, we have basic ones and premium ones, and about three or four packages. Yeah, so depends on the patient's needs and how thorough they want to check their health.
I see.
So basically, even the basic one is quite quite a good package. Includes like chest X-ray and the ultrasound abdomen pelvis. They can see their uterus and ovaries. Yeah.
Oh, even the basic one, not just urine test and blood test.
Yeah.
So guys, please, all right, please share this 𝗪𝗲 Live so you have more friends, you know, your female friends would join this 𝗪𝗲 Live, because we have some good discount for you as well. I'll tell you later. Okay, so I would like to ask Dr. Why are you laughing? I give discounts, right? Yes. So Dr. Christina, Dr. Jennifer, I would like to ask, all right. I'm sure most of our audience would know this. We have been doing this show almost every year, but I would like to repeat again. What are the most common cancer in women?
Okay, I think for women overall, the most common cancers are still breast, lung, and colorectal cancer, right? But when we're talking purely about female cancers, then of course the main one is still breast, okay, followed by uterus, then cervix and ovaries.
Okay.
Yeah. So if you're just purely talking about female
cancer,
cancer,
What about the survival rate for each cancer?
So survival rate is very much associated with what stage when the cancer is detected. So as oncologists, we really would like the patient to be detected, if at all, at an early stage. For example, if it's a patient is detected at stage 1 or stage 2, where the cancer is still very much localized to the site where it comes from, then you have a very good 5-year survival rate of 90%. So it translates to, in a simpler term, that 9 out of 10 women will still be alive and well without any cancer recurrence in 5 years. So that's fantastic.
9 out
Up
of
to
10 is
90. So this
90%.
is like a general rule.
Right.
So if the cancer is detected at stage 3, so this is where we say the cancer is locally advanced, so it may have spread to the nearby organs or lymph nodes, then the survival rate can drop to up to 50%. So that's almost half already. And sadly, most cancers, when they're detected at stage 4, when it has gone beyond even the local site, like to the lung, liver, or bone, this can drop to about 15%. So that's why the survival rate is very much associated with the stage. So the earlier the cancer is detected, the better the survival outcome is.
I see. That.
I know doctors, we sound like a broken record when we said, go for your screening, go for your screening.
Right.
Yes, there's a good reason for that, right?
Yes,
That's what
exactly.
Jennifer said.
And also, you know what? I always believe that the earlier it get detected, the cost to cure it actually is much lower. Right?
It's simpler.
Yeah, it's simpler. It is much more financially manageable. So I think I would like to bring this out, right? To achieve the goal of creating awareness of the importance of health screening, Sunmed's Wellness Center actually is offering 20% discount. Yeah, this is what I'm talking about. We are actually offering 20% of discount on women health screening just for this 𝗪𝗲 Live. So guys, please sign up for this women health screening, and then you are entitled to a 20% discount. And then the first 10 participants of the first 10 people who sign up for this health screening, actually you will get 20%. And if you want to sign up, please, yes, this one. Please scan this QR code. I will give you a minute to scan this QR code, because we actually have a lot of benefits on this 𝗪𝗲 Live. Not just this 20% discount on the women's health screening, we actually is offering free cervical cancer screening as well. It's totally free, okay? And up until this month, February 28th, there will be another QR code as well. I just want to make sure, is this a QR code for the free cervical screening? Okay, not yet. This is still the 20% discount for the women health screening. Remember, the first 10 participants will get this 20% discount. Okay, yes, here it is the QR code for the free cervical cancer screening up until end of this month, February 28th. So, and in speaking of cervical cancer screening, I would like to ask Dr. Tom, does Sunmed's Wellness Center actually offer this HPV vaccine?
Yep, we do have HPV vaccine, and I'm quite happy nowadays because I see more and more women that are coming over to get this HPV vaccine. The awareness is better compared to when I started working like 10 years ago. Yeah, so we do have this HPV vaccine over here.
I see. So how effective is HPV vaccine?
very good, very effective,
Okay.
almost near 100%. The earlier you get it, the better it is.
The earlier you get it, so before you expose to the virus.
Yeah, as early as 9 years old, 10 years old, you can get the vaccine.
Oh, really?
Yeah.
Okay, okay. For all of you, for your information, actually the HPV vaccine targets the HPV types that mostly cause the cervical cancer. And as a matter of fact, it protects HPV types that can cause most genital warts, which is like skin infection on the genitals. So with that being said, it's recommended for men as well. And currently we are running a promotion. It's a lot of 好康, right? So we are running a promotion. 3 doses only for 1,488. Yes, this is a poster. And normal price is 1,935, 1,935 ringgit. So in other words, if you sign up for this HPV vaccine, and you can save up to 450 ringgit. Okay, so next. So we should probably keep delivering the good news. Earlier I have the share and win game, right? Which we will be giving out the 5 winners that will be entitled for the Grab vouchers. Let's see whether I have the winner yet or not. Okay. Oh, not yet. So that means that you all still need to keep sharing. And probably for now, okay, let's see. We should get some question answer because I already have some question here. So doctors, okay?
Okay.
Okay, the first question. Can endometrial cancer patient get pregnant?
Okay, so it very depends on the stage that the cancer was diagnosed. To be fair, endometrial cancer usually tend to occur in women who are a lot older.
I see.
Yeah, so women usually 50 and above. So most of the time, they would have already completed their families, or in people who are single and never have children. So by nature, endometrial cancer is cancer that has arisen from inside the uterus. So most of the time, the treatment require removal of the entire uterus. So this is something that, you know, is very important for women to know also. Part of the screening is also to detect it as early as possible so that she doesn't need extra treatment besides surgery. So uterus cancer is perhaps the one that may be a bit difficult to preserve fertility when it comes to treatment, even in the early stage.
Understand. Okay, as a matter of fact, later we will cover more about the family planning and all that. So you please make sure you stay with us until the end of the show. And the next question, excuse me, next question I believe is for Dr. Tong. Pap smear need to screen regularly?
Yeah, it's good to screen pap smear regularly. Usually we recommend for those people who first time doing the pap smear test to do it every year for 3 consecutive years. If all the 3 years are negative, then you can do it every 3 years.
All right, there's a question about tumor markers. We will talk about the tumor markers as well later. What is the minimum age for pap smear?
I would say because pap smear is more recommended for people who has already have history of sexual relationship. So let's say if you have a sexual relationship as early as 20 years old, you are recommended to do it already.
I understand.
Yeah.
Is that a minimum age gap? Minimum age for pap smear?
Not really. Not really. There's any minimum age for it. Yeah. So like I said, if you have history of sexual relationship, then you can do it. And actually, there's another test which we call the HPV self-test kit. That one is more recommended for people who have no history of sexual relationship before, and yet they want to check whether they have been like exposed to this HPV virus. So they can actually get the kit at even pharmacy. Yeah, and the accuracy is quite good.
And then this question asked, she had her HPV vaccine when she was 21 years old. Do she need to do it again?
I would say depends on the types of HPV vaccine that she get, because the earlier ones covers like 2 strains. Then the later ones, like the newest one, Gardasil 9, is cover about 9 types of HPV virus. So no harm taking the latest version HPV vaccine, but I would say if you have already taken HPV vaccine before, which it usually covers the most dangerous types, so whether or not you want to take it again is like up to you. Yeah, but it's recommended to take also. because it covers more types of virus.
I understand. And then this is another question for Dr. Tong as well. Which is good. A lot of you are actually quite aware of your health. Another question is that what are the symptoms of HPV and how can I check if I have them?
Very difficult.
She actually
Yeah, very difficult. I
Really?
mean, HPV, almost every one of us will have some form of HPV virus on our body.
So what does it look like?
What does it look like? You can't really see.
Okay.
Yeah, so there is you won't really have any symptoms as well. By the time you have symptoms, it's already like quite late. Quite late stage. So, but most of the HPV virus that we have on our body are not so dangerous. Yeah, the dangerous kinds there are few types of dangerous HPV virus which can be detected from the HPV self-test kit. Yeah, if it causes symptoms, for example, like foul smelly discharge, blood, intermenstrual bleed, like blood spotting, or post-menopausal bleed.
Right.
I would say early stage when you get infected, most of the time there is no symptoms. But when you get those kind of symptoms, please look at the camera. Please go and seek for gynae. Yeah, seek for the gynecologist specialist. Must check. Yes,
right.
yes.
And then this lady, she says, I have missed my period for several months. What should I do? And could this be a sign of cervical cancer or any other health issue?
Okay, depends on her age now. If she is near to like menopausal kind of age, it's quite normal. But I mean, regardless, if you are concerned, just go to the gynecologist and have a check.
Yes.
Might not be cancer, might just be some hormonal issues. Yeah.
Yes.
So, but just get it checked.
Yeah, especially now we have 20% discount. If you have not signed up for this, can I show the QR code as well? All right, admin, yes, please show the QR code for them to sign up. The first 10 participants of the first 10 people who sign up for this women health screening, you will entitled for 20% discount. Okay, this is actually especially just for this FB Live. You probably won't get 20% outside. Okay, there's a couple questions for oncologists. Dr. Jennifer or Christina, please help to answer this question. The first question is, what can I do to reduce the risk of getting breast cancer?
Okay, so I'll take that one.
Okay.
Of course.
The next one is harder.
Okay, that's good to know. I mean, of course, we always advise screening. So the usual, do your regular monthly check, especially after your period. So always do it after your period when your breast is less engorged. And of course, know your family history. That's important. So try to find out from your mother or grandmother any family history of not only breast cancer, ovarian cancer, uterine cancer, because they are sometimes interlinked. Of course, other factors like lifestyle, healthy lifestyle, maintain a healthy weight, exercise, stress management, okay? And of course, there are other things like, there's the risk factors of, getting pregnant or having children at a slightly earlier age and having breastfed your children, so that helps.
I understand. So actually, Dr. Christina have touched about the family history. Actually, the next question is about family history.
You're right, it's harder.
Yeah. That means that I've been doing this show quite long enough to know that which question is harder. Okay. So this question is, okay, let me bring up the question. She say, there's a family history having uterus cancer, like her grandmother. Is there any chance her daughter or grandchildren will be having uterus cancer as well, or uterine?
I think we get this question a lot, especially when family members also accompany the patient to our clinic.
Yes.
Like, will I get this similar cancer? So cancer doesn't happen overnight. So actually what we do as part of our job as an oncologist is to chart out the family history. So sometimes we see this pattern of cancers. So just because somebody in the family has got one type of cancer, like in this case uterus cancer, it doesn't mean that it can be inherited. So that's important to because some cancer can be sporadic. So mutations happen along, over time, and age itself is a risk for developing cancer. But that said, I think the most important thing is to have awareness that cancer can run in the family. So if you have what we are concerned, if there are few family members, especially we say the first degree, so if the mother or the siblings or the children has cancer, so that's considered, or sisters, so that's considered first degree relative. So that brings the risk of cancer to the next of kin higher. Then of course there's also extended family. So again, we also have geneticists, genetic counselor that can come in to actually map out the risk better and then decide what kind of genetic testing to be done for an individual that does not have cancer yet.
All right, that's good to know. And there's a question about cervical cancer as well. She actually asked, what are the treatment options for cervical cancer, and what are the potential side effects?
I'll take this question. Sure. So essentially, the cervical cancer is a cancer that arises from the cervix. Okay, so this is a gynecological cancer. So usually we are referred by the gynecologist upon getting a biopsy and confirming. So the important thing is the stage. So if the cancer is well localized and 4 centimeters and below, a lot of time the patient will be counseled for surgery. So that's removal of the usually the entire womb. But of course, if the women decide to want to preserve fertility, want to have children, so there is an open discussion if that's possible, also depending on the extent of the cancer. So sometimes they can do a cervix sparing surgery so that the woman can continue to have children later. But let's say the cancer is from stage 2B onwards. So this is essentially the cancer has gone to the side wall. Yeah, so surgery becomes a little bit more difficult. So that's where we come in first. We give concurrent chemo and radiotherapy.
Understand. So I think the key word here is that the patient must discuss with the doctor in advance whether they plan to start a family to have baby.
Absolutely.
So the doctor, the oncologist can lay out what are the options for them. So it's always important to open up, to just have a good discussion with the doctor whether you really want to start a family. Okay, we'll take a break from the question taking now because I already have the list of the winners. Okay, congratulations to these 5 winners on our share and win contest. The first one is Wen-Xin. Wen-Xin, congratulations. Thank you so much, doctors. Well, these are fun doctors, So please, if you have a need, please visit us, alright? Okay, of course, we don't want you to come with you. Okay. And then second winner is 𝗓𝗏𝗧 𝗪𝗲𝗓𝗏. Congratulations. 𝗓𝗏 is the third winner. And then 𝗪cie Vanessa. And the fifth winner is 𝗓𝗏𝗧𝗪𝗏. Sorry if I missay your name. 𝗓𝗏𝗧𝗪𝗏. So congratulations to all these 5 winners. Let me repeat again. Wen-Xin, 𝗓𝗏𝗧 𝗪𝗏𝗓𝗏, 𝗓𝗏𝗧 𝗪𝗏𝗧 Vanessa, and the last one is 𝗓𝗏𝗧𝗪𝗏𝗧. Okay, congratulations. And our admin actually will contact you to get your personal details, your contact numbers. So we will send you the link for you to scan to get the Grab vouchers. Okay. The next question. Yeah, it is.
May I just chip in here?
Yeah.
Because I think from cervical cancer, we are very lucky in a sense that we have the vaccine. So that's hoping to prevent people from getting cervical cancer. And then you have the Pap smear, which is a screening thing. So hopefully because people always get confused, Doc, I don't want to do Pap smear, it's so painful, can I not do it? I just do the kit. Yeah. But Pap smear is very important because you're hoping to detect cells that are precancerous.
Yes.
Okay, so you have a vaccine that can hopefully stop people from getting the cancer, and then you have a Pap smear that hopefully detect people before they become cancer patients. So we're quite lucky in that sense. So modern medicine is really moving forward in this aspect. Yeah.
Right, that's good to know, especially Dr. Tong earlier mentioned that there's really no symptom
Yes, at the early stage,
yeah.
absolutely.
So it's
yeah.
very important to get the screening.
Yes.
So the next question actually is for Dr. Tong. As a matter of fact, one of our audience asked this question: what is tumor markers? Because at the beginning of the show, I did mention that, right? Tumor marker is not the most effective way in detecting tumors. Why is that?
Many people actually came to health screening. They say, doctor, I want to add on tumor markers.
Well, they asked that?
They asked for it, and during the consultation when I explained, okay, your tumor markers normal, phew, I got no cancer. They will have this kind of reaction.
Which because because in the treatment, tumor markers is one of the methods to determine how well is the patient respond to the treatment.
Yeah. So actually, this is a very wrong kind of. It's like a misunderstanding. Yes. Tumor markers actually is meant for oncologists, for specialists. After the patient been confirmed, diagnosed to have cancer, then when they start the treatment, they want to see how well the patient progress or responds to the treatment. But it is not a test to diagnose, or in other words, it's not a test to detect whether you have cancer or whether you have precancerous kind of sign. So very often, even I've seen some cancer survivors, when they come to do health screening after that, when I just chat more with them, they will tell me that, oh, my cancer detected from ultrasound breast, from mammogram, but my tumor markers are normal. Yeah, those happen for stage 1, stage 2 cancers. So I would say if you come to health screening, your concern is about whether you have any signs of cancers. Please don't focus on tumor markers because it's the least accurate way to check. Instead, you should do other things, for example, the X-ray for lung cancers, and then the abdominal scan for liver, kidney tumors or uterus, and also the pap smear as well. Right. So if you are not too sure what test to do in your package, please consult the doctor in the health screening department.
I understand. Yeah. So again, I would like to emphasize here, right? The tumor marker test is important to determine how a patient is responding to the treatment, but it's not the best method to decide to detect the tumor. So maybe I need to ask Dr. Christina or Dr. Jennifer. So how many tumor markers are there in the market?
Well, I think the most common ones we use, there are about 5 of them. Right. So they are CEA, CA125, 153, 199, and the alpha-fetoprotein AFP. You'll be surprised to hear that about 20 to 30% of our stage 4 cancer patients have absolutely normal cancer markers. So I totally agree with what Dr. Tong said just now. But of course we get asked, so should we not check anyway, doc? So no need to check. I think to be fair, this is included in a lot of packages. So if you look at which hospital to go to, you may be tempted to choose the one that offered this tumor markers.
I would, because I know there's a lot of lab tests out there do this.
I think part of the health screening packages, you check blood for your sugar, your cholesterol, and all that. So the way I would usually answer this question, I'll say, well, since you're already doing blood tests, fair enough. Just do the cancer markers. Because we do hear, and I'm sure Dr. Jennifer will share same story as well, there will be one maybe lucky or unlucky. They do a health screen, and if they do the chest x-ray, it's normal, and one of the cancer markers is a little bit high. Right. And that prompted the doctor maybe to do a CT scan. Because I have one patient like that, and they pick up a very small lung cancer. Yeah. So, that's why I said whether this person is considered lucky or unlucky. But we don't use it like a main way to diagnose cancer, because 30% of it's going to be normal. So if patients are doing a health screening and they're taking blood tests for other things, like kidney function, liver function, I suppose there's no harm to just throw it in.
I understand.
Yeah. But it's not like, phew, it's normal, phew, I don't have cancer, that kind of thinking still. So absolutely, yeah.
Okay, I think I would like, because there's a lot of questions for you, I think I need to take some questions right now. She asked, I have done my surgery and treatment, and is there a chance of the recurrence of or any other form of cancer?
So if you get the question right, it's done the surgery and treatment for the cancer.
Right.
So we say that the risk of cancer recurrence lessen over time. So especially the first 24 months, so the risk of the cancer relapse or recurrence is higher in most cancers. So for the first 2 years at least, and then actually it's a long-term follow-up. So but as the years go, then the follow-up may get longer and longer.
I see.
Yeah.
So not that frequent anymore.
Correct. So the important thing, because again patient asks, why do I need to come back? Because sometimes we need to get some history, certain things that may promise to know whether the patient is well or unwell. And each examination, each follow-up comes with an examination. So if we detect anything that is, a little bit abnormal from the routine for the patient, we can then pick up these symptoms early and then maybe arrange for a scan.
Understand.
But I'd like to echo what Dr. Christina said about tumor markers. I think this is very important take-home message, that if you do the screening and it's part of the screening test, it's very tempted not to do it.
Yes.
But I think when it is normal, it is not a full reassurance.
It's a proof,
Correct. So patient wouldn't, they skip the colonoscopy
Right.
or the mammogram or pap smear.
Right.
So these are tests, screening tests that are well validated and they save life. So you still have to go for it.
Right,
Yeah.
right. And then actually I'm quite glad to announce that was, unless at least not an official statistics, that quite a lot of people are very aware of the importance of health screening, because there's a question from here: at what age do you encourage regular health screening?
Personally, I'll encourage after 40 years old to do the health screening yearly,
Mm-hmm.
but not all the tests. Yeah, and before 40 years old, you can do the screening test maybe every like 2 years. Yeah, so you can start doing as early as like 20 years old. Yeah, depends on the the hospital. Yeah, some hospital screening center, they accept patients after 21 years old. Some they accept patients after 18 years old.
I
Yeah.
see. So maybe I need to ask a follow-up question. Based on your observation, do you encounter any cases or anybody who actually reluctant to come to screen test, but for some reason, for any reason, he or she is forced to come to do the screening, but at the end, it turned out she or he had cancer?
Yeah, quite a number of patients that I've encountered. Got one patient which, I remember her because she's actually a staff nurse. Yeah,
Oh,
and
she's a nurse.
she's a nurse working in medical field. Her age is about like 50, around 50.
Right.
So that time she came with her husband. And then when after asking all the histories, I do a quick examination on her, and I found that there is a so obvious lump, hard, on her breast.
So she's a nurse, so
Yeah.
she should know that it's a lump.
I asked her, I said, how long, do you know about this? She said, yes, I know. I asked her, like, how long has it been there? And she was quite reluctant to tell. So I asked her, like, had she like seen any specialist before? And she said no. Yeah, she's like, I think she knows something is wrong, but she don't want to face the reality.
I see.
Yeah, so I told her, I'm sorry, I really have to refer you to the breast surgeon and to go for further checking, because the earlier you get the treatment, the better the prognosis. So then I think end up she is being diagnosed with the breast cancer. It's about stage 3, if I'm not mistaken. Yeah, so yeah, she's a staff nurse.
I
Yeah.
understand. I think this is probably not the only case that happened,
No,
in
no,
our society.
yeah.
Maybe I should ask Dr. Christina and Dr. Jennifer. Does it happen? Have you ever encountered? I'm sure it does, but I'm just not sure how many.
Yeah.
Encountered a patient who came to you, right? Actually, she came to you, right? Actually, she already had a cancer, and I'm sure if she never done any screening, and I'm sure more life could be saved if the screening has been done. Do you encounter these cases where it's kind of too late? I mean, not too late. It's kind of like, it will be a very complicated situation because it is at the 3rd or 4th stage. But her life or his life could have been saved if the screening was done earlier.
I think as mentioned earlier in the program, if you get detected early, then the treatment become less complex and also less costly,
Right.
and then improve their outcome. So we have this scenario, is an increase in our clinic where the patient will have, because breast lump is almost always palpable. So it's also quite sad. Sometimes you have the patient actually get biopsied and then confirm it to be cancerous. And so like from a 1 centimeter tumor where it could be easily removed, stage 1, and then they waited, and maybe do not go for further follow-up. And inevitably, they come back because of pain, or when the mass has, or the tumor has ulcerate.
Right.
So the pain brought them in, and it became a stage 4 disease.
Right.
So it's sad because, it was detected at stage 1, but unfortunately, we then treat her at the stage 4 setting. Of course, we had a lot of advancement in treatment nowadays,
Right.
but whenever someone is detected at stage 4, the cancer is always for control of the symptoms. It's hard to be able to offer them full curative intent. So these are the many scenarios, and I think we should do more in terms of minimizing the stigma. So like the nurse example is a good one. So you get even professionals. You think that someone who come to see Dr. Slick is someone who is probably a lack of education and awareness. And the answer is not really.
Yeah.
So we have professionals who are also afraid. They know likely this is a lump that is cancerous, and yet the fear of going to see a doctor or the stigma of being associated with cancer prevent them from coming early.
I understand. So I'm sure the situation will get much more complicated if the patient is pregnant.
Definitely, yeah. When a patient is pregnant and diagnosed with
Right.
cancer, there's a lot of limitation to the tools that we can use to diagnose the cancer.
Right.
So for example, we won't be able to use a PET scan or a CT scan because the radiation involved in these scans will be harmful to the unborn baby.
Right.
Okay, not to mention even the treatment. So like treatment that like chemotherapy or radiation therapy. So we would really need to sit patient down and go through the case carefully, what we can do and what we cannot do. But you'll be surprised to hear we have successfully treated some of our pregnant breast cancer patients.
Oh, so that means a cancer patient actually potentially can keep the babies during the
Yes.
treatment?
Absolutely.
Oh, okay.
Yeah.
So can you share with us one of the case?
Well, I remember I had a 38-year-old patient.
All right.
She was pregnant with her second child, and she felt a lump in her left breast
During pregnancy?
during pregnancy. I think it was around 10 weeks.
Mm.
So she came and see the doctor early and everything, and we diagnosed this with a biopsy, confirmed it was a breast cancer.
Right.
But we couldn't do a CT scan or a PET scan. But we did what we could. We did abdominal ultrasound that's safe for the baby to check it hasn't spread to the liver or the internal organs. We really had a long counseling session with the patient and her husband because they were really contemplating whether they have to abort the baby for treatment. And so with her, we counseled her to wait for 2 more weeks when she entered into the second trimester, so we can give chemotherapy safely in the second trimester
I see.
once the baby's all internal organs are formed.
I see.
Yeah, of course not all chemotherapy, but now worldwide there's a lot of data collected from all the hospitals internationally that some chemotherapy can be safe.
Mm.
So she went on to successfully, receive 6 cycles of chemotherapy. The breast cancer was well controlled. Eventually, she had her surgery and delivered her baby at the same time. And now the baby, well, no more baby, is already a toddler. She's 3 years old. And she brings the baby to come and see me when she comes for her follow-up. And I can see the baby is growing up
It's healthy.
and
Right.
normally. Yeah. So
Yeah.
we successfully treat our pregnant breast cancer patients.
There you go. That is actually a successful
It's
case.
very fulfilling. right?
Yes,
Yes.
absolutely.
Treat,
Yeah,
cure her
yeah.
cancer, and then the baby.
Yes,
Right,
to
right.
think that they were actually contemplating aborting the baby.
Yes,
Yeah.
yes. So how? What stage was she when she was
Yeah,
diagnosed?
she was diagnosed at stage 1.
Oh, so again, it's very important to be diagnosed as early as
Yeah.
possible, right? So then I think, sounds to me, anybody who plan to have a family, who plan to have babies, should come and visit some mass wellness center. Maybe I should ask Dr. Tong, have you have any cases, right? Or any visitors or patient, or not patient, have any people who walk into the wellness center and try to do a health screening just because she is planning to get pregnant?
Yeah.
Oh, it does?
Yeah, have quite a number of them. And usually the packages that we recommend to them includes some of the tests, for example, to check for hepatitis, check for HIV. Yeah, so yeah, there are people who come to do like premarital screening or like before pregnancy, they just want to have a check. Yeah, but I would say for those people who want to check for fertility, and that's different thing.
I see.
That one we will leave it to the fertility specialist.
I understand.
Yeah.
I understand. That is really good to know, a good sign, right? As a matter of fact, I think anybody who plan to have a family, who plan to have babies, should come and visit us. It's not paranoid, but why would term it as family planning? So in terms of, in speaking of family planning, right, I would like to ask Dr. Christina or Dr. Jennifer, right? When a patient is undergoing a treatment, can the patient have sex?
Absolutely, why not?
I don't know, that's why I asked. I'm sure. Do you get this question often by the patients?
Yes,
oh, you
we do. We
okay,
do.
See, it's not something that we shouldn't talk about. You know, it's just like we feel like, you know, our society is Asia, so we shouldn't talk about. But actually, we should. It's called education, right?
Mm-hmm.
Yeah, exactly.
Yeah. I think, you know, when a patient is undergoing cancer treatment,
Right.
it can be very intense, again, depending on the site of treatment. For example, if the patient is undergoing pelvic radiotherapy, so they may get a lot of soreness around the muscle area, you know, vaginal dryness. So that may make sex a little bit more, you know, uncomfortable. Yeah. So it's always good, you know, when the spouse of the woman comes in together during the consultation, and we can have open discussion on, you know, when the patient is ready. So maybe these are like used to be taboo, but nowadays we have patients asking us, you know, if they can have sex, or is whether when they have sex, the radiation is going to affect their spouse, you know, all these questions.
So, to answer that question, will radiation affect
no.
the spouse?
Because we're using megavoltage X-ray,
Right.
so essentially the radiation is not radioactive, so it does not transmit to the spouse.
I see.
You know, the patient's not radioactive.
What about cancer? I'm sure some of the patient, right, because she loves her partner so much, she might have concern. Will she pass the cancer to her partner?
No, cancer is not infectious in that way.
Right.
So of course, when we discuss this topic of sex and sexuality with our patient, I think it's very important to educate our patients. So when is the best time to have sex, what you should be aware of. So for example, like a patient who is undergoing chemotherapy, you know, you may feel unwell immediately. So for the first 2 to 3 days,
Right.
you know, you may feel so tired that you're not interested at all. And you know, some of these chemotherapy drugs may actually be secreted in the, you know, in our secretion. So in those first 2-3 days, we don't advise you to have sex anyway. And then you would need to know, so when your cell counts are low.
Right.
So for example, our chemo patients, you know, the white cell count may be low, the platelet count may be low. That's when the time you are vulnerable to infection, or they may be bleeding if your platelet count is low. So those things you need to be aware of. And when the 3rd week, you may be the best, you may feel well. And yes, if you feel you want to have sex, why not? Now, this is a very taboo topic because, you know, you think like cancer patients still got wood to have sex, you know? You see,
Yeah, exactly, because, you know, when you were diagnosed with cancer, you get shocked and everything, but do they really?
Yes. I mean,
having sex probably is the last thing they will think
absolutely.
about.
I think when someone is diagnosed, when a patient is diagnosed with cancer, you know, the first thing that occupies their mind is, I have to fight this,
Right.
I have to survive, I have to get my treatment.
Right.
That's right.
Yeah, and sex and sexuality is the last thing you expect them to
right.
think about. Now, in our modern medicine, right, we are getting so much better at treating our patients. We are better in supporting them. So they cope better with treatment.
Understand.
So when they cope better, they start to think, yes, I want to be alive, but I also want to live well. I also want to have a good quality of life.
Right.
And of course, a lot of things affect quality of life, but intimacy with their closest,
Right.
with their loved ones, plays a crucial point. So I think, you know, intimacy, sex, sexuality is very important for cancer patients' mental health as well. And mental health contributes to their overall health.
Right, yeah, absolutely. And I think Dr. Christian earlier has mentioned something. Try to not to get pregnant.
Absolutely, yeah.
during the treatment.
Yes. We always advise our patient, yes, you can have sex, but during treatment, do take the precaution to avoid getting pregnant because, like I said, some of these drugs are dangerous for the unborn baby, so it may harm the baby. Yeah, so do practice safe sex when you
Right. And it's absolutely very important that, sex is not all about sexual intercourse. It's about intimacy as well.
That's
it definitely will help you to get better. It's your overall package of your well-being, right? So, but I'm sure during the treatment would affect the sexuality. So how does it affect, and how to improve it?
So like physically,
You
again.
smile, so you look at her.
So we encourage, sometimes if the patient is ready. So I think, cancer is a physical stress, it's a mental stress.
Right.
So I think the main thing is that the patient is ready, and she feel like she would like the intimacy with her partner.
Right.
Then we can say sometimes use some aid. So vaginal lubricant, that helps a lot, especially in dryness. Yeah. And then sometimes, like you say, sex isn't just sexual intercourse.
Right.
So there's a lot of like maybe cuddling, massages that you can give, things like that. So things that can replace, because ultimately it's the bond. So some patient prefers to go a little bit slow, start back the bond. And I think the spouse here is very important, their role, to just let the patient be ready and take the cue as it goes.
I think totally it's intimacy is not purely about having sex.
Right.
It's just like what Dr. Jan said. Just having a nice candlelight dinner with your spouse, going for a walk hand to hand, talking. So that would helps to build the intimacy.
Right.
Yeah. Of course, there's a lot of physical effect of treatment that may affect a patient. Well, since we're talking about women, like a woman going through chemotherapy may lose her hair. She may feel unattractive.
Right.
Or she may fear that her husband, her spouse find her unattractive and doesn't want to have sex with her.
Or she may just undergo a breast surgery.
Yes.
So loss of a breast, that is such an important, impression for women, right?
I understand. Yeah. Okay. So absolutely, and I think the key takeaway from here is that the communication between the patient and the partner is very important. You just do what you feel comfortable. So do the things that you want to get back your normal life. So there's a question here which I would like to ask also. Can survivors have babies?
Yes, we have many patients, women, who then come back to us with children. So it all really depends on what stage. So again, the earlier the stage it is, so there are better chance of cure rate. So the thing is, if the patient is, if the woman is diagnosed at stage 4, then a lot of time we do not encourage them to get pregnant because we know that if the cancer get worse, the pregnancy may not be viable. The woman may not be able to carry through 9 months of pregnancy. Yeah, but if it's early stage, and again we advise not to get pregnant for the first 24 months. That's a crucial period.
I see.
Because that's when we think the cancer risk of recurrence is highest. So after 24 months, some women, like on breast cancer, they're on hormonal therapy, which is usually given for 5 years. So let's say after 2 years, she decided that she'd like to start trying for a baby. The important thing is speak to your doctor so that there are certain things we need to do. We may need to stop the hormonal therapy for a few months ahead, just to have like a washout period, before they get pregnant, things like that.
I understand. So let's take some questions. There's a question here. Can continue pregnancy later after delivery? Oh, okay. So what her question is pretty much this. Can she first deliver the baby first, then only continue the treatment? Meaning, she finds out she had a cancer during pregnancy, but can she stop the treatment, but only after delivering a baby, do the treatment?
Yeah, it's a very difficult, very difficult question to answer because, at the end of the day, it is a personal decision that the patient has to make. So of course, it really depends on where she is in her pregnancy. So like the example I gave, if a patient found a breast lump that's really small and she's almost due date That means, you know, she's going to deliver in 2 weeks or 3 weeks. Then maybe it's okay to wait. But if she's, you know, a more advanced stage, so she's a stage 2 or a stage 3, and very early on in her pregnancy, so there's always the risk that the cancer will spread. So that really depends on each individual case. Yeah.
Also depends on how aggressive is the cancer.
Absolutely, yeah. And of course, sadly to say, there are cases where we may have no choice but to treat, because otherwise, you know, we always say you always have to treat the mother.
Yes.
Right. Because people will always think, as you watch in the movie, always
keep
sure
the
to keep the baby,
right.
keep the baby. But I think it's very important to
keep the adult first.
You know, save the adult first, because you can potentially go on to have other
Right.
children later.
Absolutely.
Yeah.
Right.
Yeah.
And then there's a question, I think it's for Dr. Tong, or as a matter of fact, any doctor can answer. What does breast density D mean? Because her mammogram shows her breast density is D.
Oh, okay. So type D breast density means the breast is very, how to explain it? I usually explain to my patient that it is very thick, very like dense. So that one actually is not much of an issue. Mostly they get this kind of dense breast if their age is still like 40 plus, around 40 to 50 years old. Mostly they get that kind of result, and they might end up need to do ultrasound breast to increase the accuracy, because if the breast is still dense, it can actually cause the accuracy of the mammogram to be lower. Yeah, so
Can I chip
Yeah.
in here? Because we are all women.
Right.
We are women.
Yeah.
You don't
Which is
understand.
it's good to know for all the gentlemen out there to understand.
Yeah, it's just that I think women have this fear of doing the mammogram. It's because it's very painful sometimes.
Oh, is it?
Yeah.
I see.
So I get asked a lot also. It's like, Doc, can I just do the ultrasound? I don't want to do the mammogram, can or not, because it's so painful. I think it's also important to explain. I always take the opportunity when I can to explain to the audience that
Right.
usually we try to do two. Okay, ultrasound and the mammogram.
Right.
I mean, the ultrasound is very good for patients like, you know, very young patients whom the breast tissue is still very dense. Okay, but ultrasound you can only detect if there's a lump. Okay, the mammogram is very important because just like the pap smear, you want to detect precancerous changes. So on the mammogram, you see white dots, which we call microcalcification. These are what we call the early signs of DCIS, ductal carcinoma in situ. So that one, the ultrasound will not pick up.
I see.
So that's why we always do two together, mammogram and ultrasound together.
Can they just do the mammogram without ultrasound?
So usually the ultrasound will also pick up things like non-cancerous, so like fibroadenoma and all that. So usually it's together.
I understand.
It's the other way around. Always patients don't mind doing the ultrasound. It's the mammogram that they don't like doing. Yes.
I understand, because it's painful.
Yes.
So yeah, but to me, right, it's more painful when you have to do all the treatments later.
Yeah. Yes.
Right, it's
yes.
better to prevention that better than cure, right? So another question for Dr. Tong as well. So after they walk in, like all these questions that I come in, apparently a lot of our audience are very well aware that, you know, they should do the health screening. So after they walk into the Sunmax Wellness Center, right, after do all the tests, and once they have diagnosed with cancer, what is the next step?
Okay, I'll say from health screening, seldom we diagnose cancer. The result usually they will say come out to be like suspicious of malignancy. So we will refer to the next step. We will refer to the specialist. For example, if for breast cancer, we will refer breast lumps, suspicious lumps, we will refer to the breast surgeon. And for uterus, ovaries, we will refer to the gynecologist. So they will do further, more advanced checking, PET scan, MRI, or like the biopsy, in order to confirm the diagnosis. And from there, they will then collaborate with the oncologist to plan for the patient's treatment.
So there will be different departments to go, depends on the situation.
Yep.
Oh, that's good to know, right? Because I know there's a lot of people out there, when they're diagnosed with cancer, they will get shocked, and then they get worried, they will 𝗪𝗪𝗪𝗪, they don't know what to do. And then most of the time, I believe, like my sister as well, my sister was the 4th-stage breast cancer patient. So they will like just ask around, probably ask the wrong question to the wrong person, and get sent to different department, which is will delay the treatment, which is making things worse. So guys, so please make sure you actually are visiting, you actually will make the effort to visit Summit Wellness Center. The first 10 people who participate in our women health screening will entitled for 20% discount. And all right, so it's about 12 o'clock, so I think it's time to go through the quizzes. Earlier we already announced there were 5 winners for the Share and Win, which entitled for grab vouchers. Coming up next is the quizzes. Oh, there's a question coming in. Okay, let's take this question first. As a cancer survivor, is there a chance for me to still get pregnant, or is it too late? Actually, we have kind of answered that question. Maybe she missed it. If you don't mind, let's answer again.
I think that question also, there's a lot of information that we would need also, like how old are you, what type of cancer, what treatment you have. So I think certainly have that discussion with your oncologist or your doctor if you have that desire. Just like how we mentioned, if you're on hormonal treatments, for example, for breast cancer, we may advise you to stop that for a few months if you're planning to try to get pregnant. So do go and see your oncologist to discuss this.
I hope Dr. Krista answered the question, but for further discussion, definitely need to talk to the oncologist. Of course, you're welcome to visit us anytime. All right, let's get on the quizzes. Why are you smiling? Which is good. Actually, we have, I must tell you guys, these doctors are fantastic. They are really friendly. And then, it's not like it's not like doctor. They actually can make jokes. And which is good.
Doctors don't make jokes, right?
Yeah, okay.
Doctors don't make jokes, right?
Well, in my impression, they don't. They're very serious. Which is good, right? Okay,
the
so
fun
now.
one,
Indeed, which is good for their, when you are undergoing the treatment, they need
that's
back
right.
on track to their life, right? They don't want to be so serious all the time.
Yes.
It's good.
Yes.
So, all right, now let's do the quizzes. Okay, are you ready? So, okay, what I will do, I will ask 3 simple questions. All right, all these questions, all the answer for this question have already mentioned throughout the show. All you need to do, if you know the answer, you just type the answer in the comment, and then I will randomly pick my figure to get the answer. If your answer is correct, and you will entitled for the grab voucher. Okay, let's show the first question, will you? All right, then question number 1. A tumor marker test is an effective cancer diagnostic method. True or false? All right, just give your answer in the comment, and then after that, I will scroll my screen, which I'll be live, to randomly point to the right answer. If your answer is correct, then you're entitled for the grab voucher. Let's see. Okay. All right, guys, are you ready? Please give me an answer. I probably need to wait for a while because there is a lag time between live and okay, let's see. All right, give me an answer. Okay, there are some answers coming in already. Okay, true or false? True or false? Okay, let me wait a few more minutes. Okay, the first question, tumor markers test is an effective cancer diagnostic method. Is that true or false? Effective for health screening. Okay.
To give tip.
Yeah, give tip already.
Diagnostic.
It's good during treatment to determine how well a patient responding to the treatment. But now it's diagnostic. Okay. Okay, let me point. Let's see. Okay, zoom in, zoom in, zoom in, zoom in, zoom in, zoom in. This one. Okay. Jamila, sorry, it's not true. So which is false? So please give me a right answer because we just want to give away the voucher. So give me answer. Remember, tumor markers is not the most effective way for cancer diagnostic method. So please type B. Okay. So we have good people. See? All right, please type B. Okay, here. Elaine Yi, congratulations. Yes, B. Remember, tumor markers is not the most effective cancer diagnostic method. Okay. Although I know there's a lot of lab tests out there, include this as part of the package.
Yes.
But yes, because I myself also fall into the trap. So I know very well as a person. Okay, next question. Let's show the next question. Both men and women can receive the HPV vaccines. Okay, both men and women can receive the HPV vaccine. True or false? Okay, it is HPV. I'll give some tips. HPV vaccine targets HPV types that commonly cause cervical cancer, but at the same time, it also protects against HPV type that cause most genital warts. Okay, which means that which means that it should be recommended for not just one gender. So please give me the right answer. Okay, true or false? Let's zoom in. All right, this guy.
How come we never get this teacher at school?
Yeah, Jocelyn Tutor, Jocelyn Tutor. Congratulations is no why you give me B? B is wrong. So let me scroll again. Okay, this one. Riza, no. So is HPV vaccine recommended for both men and women or not? Yes or no? If yes, that's true. If no, false. So true is yes, false is B. So it should be recommended for both gender, which means. All right, let's see. Okay. Yeah, Casey, go. A is correct. Okay, last question. Guy, please don't disappoint us. I know, that means that we didn't do a good job.
We better revisit the HPV vaccine chapter again.
Yeah. Sorry. That means that I didn't do a good job. So, okay, last question. Survivors can still have babies after cancer treatment. This should be.
This is our job.
Can survivors still have babies after cancer treatment? Okay, can or not? Can is A, true. Cannot, B, false. Okay, give me A, B. Okay, let's see. I think most people should get it right now. Yeah, I can tell most people get it right now. Alright, this one. Esther Chin, A is correct. Okay, congratulations to all the 3 winners. Okay, well, it's almost 12 o'clock, so it almost come to the end of our show. Let me check whether there are any more questions from the audience.
Well, before we take questions, perhaps we should maybe a bit clarify for the HPV vaccine, because I think some of our audience may get a bit confused.
Yeah.
So basically, HPV vaccine is for younger people. You want to prevent them from catching the HPV virus. And when you have sex, there's men and men, women and women. There's 2 partners.
As long as you have the sexual intercourse.
Yes, and that's how you get the virus transmitted. So that's why we stress that men and women can have the HPV vaccine.
Understand.
Okay, because if your partner is HPV positive, you can pass it to the other partner, right? And HPV vaccine is important. Just a fun fact: HPV is not only associated with cervical cancer.
Right, because that is how you marketed. So we always think that it's connected to cervical.
There is a type of head and neck cancer called oropharyngeal cancer, which happens a bit in older people. That can be associated with HPV vaccine. So it's like, it's another good reason to get the vaccine,
Right. So which is good to know. So that, I think the keyword is really you must get the vaccine, not must. It's better to get the vaccine before exposed to the virus.
Absolutely.
As early as possible.
Yeah. All right. So it almost come to the end of the show. So one last question for all the doctors, right? Start with Dr. Christina. What is your last advice? What is your advice to all our audience today?
I know I sound like a broken record, but it will be like health screening. I think it's very important. As you can hear, life gets a lot more complicated if your cancer is diagnosed at a later stage. So do go for health screening. And don't think you don't need to go. If you're under 40, go, young as you like what Dr. Tong said, because we do see a lot of younger cancer patients nowadays.
Dr. Jen?
I think a lot of women nowadays juggles many hats. We're working, we're mothers. And our health doesn't become the priority. Sadly, we put all these things at the back of our head. We're going to get that appointment in, we're going to get the pap smear in, the mammogram in. And that 1 year that you missed it, is perhaps that 1 year that things happen. So always, even if you're busy, always prioritize your health and just book the appointment in and get tested. Early detection saves life.
Yes, and I would like to chip in, although I was the one who asked question for your last advice, because as earlier I mentioned that my sister was the last stage of breast cancer. Actually, she learned about the lump in February, but she always thinks that cancer the development of cancer will take time. But surprisingly, it was an aggressive type, HER2+ or something like that, which is very aggressive. So from February to July. In July, when she collapsed, when she fainted because her lung filled with water, filled with liquid. So at that time when she did the biopsy, already stage 4. It's just like in 5 months, from stage 1 to stage 4. It's so fast. So don't always, take your chance. Things that, it's gonna take time. Cancer can't develop overnight, but sometimes it can be very aggressive. So as soon as you find something wrong, any symptom, please visit screening. Please do a screening. You can visit some mass screening center, wellness center, or anywhere. Just get yourself screened. Okay. Let's pick up screening. Dr. Tong, any last advice?
Yeah. One more thing to add on, I would say many people, they actually will think that, oh, I have this concern or I have these symptoms, but I don't feel like asking the doctor because I scared the doctor to think that I'm like stupid. Why do I ask stupid questions? Yeah, so don't be shy. Don't think that your question is a dumb question or anything. If you feel concerned, if there is anything that's bothering you, just go and see any doctor, health screening doctors or even GPs in the clinic kesehatan as well. Just ask them. At least you get an advice from a professional and not Mr. Google. So, so that's my advice.
Yeah, it's so true. I know Mr. Google. And also, look at our doctors today. They are fun to talk with, right? So come and visit us if needed. Okay. All right, that makes the end of our show. And thank you so much, Dr. Christina, Dr. Jennifer, Dr. Tong, to be our guest today. Thank you so much. And again, thank you so much for everyone who are watching our show. And again, once again, a friendly reminder, we're actually running the HPV vaccine until the end of the month. So please make sure you sign up for it. And 3 doses only for 1488. Normal price is 1935. Sorry, I must do some advertisement at the end of the show. All right. Once again, thank you so much for your time. We'll see you next time.